Hello everyone, so let's start with the session now. So this is the Grand FMGE December session 2021 Anatomy Quiz Part 5th. So let's start with the session. So yes, am I audible? Is the screen clear so that we can start the session? Let me just check. Okay. So yes, I think clearly we can start the session. Myself, Dr.Monalisa, and I have done my MD Anatomy from Armed Force Medical College, Pune, and this is the unlock code and the referral code NAT10, which can be used by you if you want to see the free sessions on the Unacademy platform. Now, about the free live sessions on the Unacademy platform, I would like to give you a brief about the free live sessions of Unacademy platform, which will be highly beneficial for you. Okay, so yes, I'm audible. Yeah. So actually today, as I told you, is the Saturday and Sunday. So I am planning Saturday and Sunday today. 2 days I am taking the sessions of clinical anatomy MCQ. So students who are interested can join me for the clinical anatomy MCQ session. Actually, this will be a series of 100 most important clinical anatomy MCQ sessions targeting for your FMGE exam, INICT, and also for the next and the NEET PG. So most important 50 clinical anatomy MCQ sessions. So you can use my code NAT10 if you are downloading the app for the first time. So if you want to see the free session on the Unacademy platform, because you will also be, after completion of the session, you will get the PDF notes also, so you can attend it live. You can attend all these clinical anatomy MCQ sessions. So it will be a series of 100 clinical anatomy MCQ sessions. The series will start today evening from 6 p.m. So the session will be of 45 minutes each, that is 6 p.m, 7 p.m, 8 p.m, and in the Sunday morning also 2 sessions I have planned. So subsequently we will cover up 100 clinical anatomy MCQ sessions. Now special class features. So what are the features of special class? So interactive live session is there. So polls are conducted in which you can participate and be present for the active participation, and you can know where you are lying, which is your weak area, needs to be more of revision required. You can revise that point. Weak areas you can know of yourself. Raise your hand and get your doubts clear right itself when the session is going on. Never miss a session. So never miss a session. How you are going to not miss a session? For example, if you start seeing my session, you start following me on the Unacademy app, you will get notification regarding my session. Lecture notes are provided. So actually after the completion of the session, PDF notes can be downloaded. This is an extra benefit which is only present in the special class or the free sessions of the Unacademy platform. Anywhere, anytime, read from the top educators of Unacademy platform. Now, I also want to tell you about the positive point about the plus subscription and also the difference between iconic and plus subscription. So when I am talking about the plus subscription, all 19 subjects are covered up in a very systematic way. You can take the subscription and you can be the part of live sessions and all the targeted examination courses you can attend, and you can have the PDF notes. So the sessions are taken by the top educators in the medical field, and also compete live in the test and quizzes and know your ranking. And with taking of the subscription 1 year or more, you will get printed notes of the plus platform of Unacademy, assess more than 25,000 MCQs, clinical MCQs based on latest pattern of examination of all 19 subjects. Now, when I am talking about the iconic subscription, the benefits of the plus subscription is added on with the benefit of prep ladder. So two important platforms are there. One is the prep ladder, another is the plus platform of Unacademy. Both of these are merged together, and you can know that clinical integrated essential sessions are there, video lectures are there from dream team of the prep ladder. QBank 3 can be assessed, rapid revision snapshots and treasure dream notes, all these can be targeted by you. So also I want to tell about the NEET PG iconic and plus subscription. If you are going for the subscription of 18 months or 2 years or 3 years, so these are the discounted rate, and you can use the code NAT10 and get an additional discount of 10%. Also you can compare the whole details of Iconic and Plus and decide which to take. If you are going for NEET PG exam next in INCT, then you have to take the subscription of Iconic, which is more beneficial. Now my dear aspirants, I also want to tell that you can go for Unacademy Plus subscription because there is 25,000 and more clinical MCQs from all 19 subjects. Now exam day is coming near for the FMG and INICT, so there is free grand test on the platform of Unacademy, so do join the free grand test. So 24th October, that is Sunday, 2 to 5 p.m. is the sessions for the free grand test targeting INICT examination. And for FMG aspirants, the test is on 31st October. So use this code NAT10 and get enrolled for these tests. Also, I would like to tell you about the 23rd October. Today is 23rd October, and in the afternoon 2 to 4 p.m. there is NEET PG 2022 free test, grand test. So you can join this session, and also you can join me for the Saturdays and Sunday special free session. Links will be provided in Let's Crack NEET PG platform, and you can have the link of the session and participate there. Raise your hand and get your doubts cleared. Congratulations the toppers. So I would like to congratulate the toppers of the NEET PG 2021 September session examination. All the best for their future tenures. Now let's start with the session. That is, so today also I have targeted in this session 15 MCQs. So let's start it. So so those who have joined can mark their answers. They can give the answers. So let's start with the discussion. Which of the following nerve is not a branch of lumbar plexus? The options are obturator, genitofemoral, pudendal, lateral cutaneous nerve of thigh. Which of the following is not a branch of lumbar plexus? So according to you, which is your best answer? Which of the following is not a branch of lumbar plexus? Obturator, genitofemoral, pudendal, lateral cutaneous nerve of thigh. So yes, your time starts now and mark the correct answer. Question number 1, mark the correct answer. According to you, which is the best answer? Okay. So I will wait for 30 seconds and then mark the answers. Okay. So whichever you feel is the correct answer, give the answer. Not a branch of lumbar plexus, not a branch of lumbar plexus. We have got 4 options and mark the correct answer. Actually, the correct answer is pudendal nerve. C. So pudendal nerve, as you know, it's a very important, it's a nerve which is actually a branch, which is giving branch to the perineal region structures, and it's not a branch which is so yes, Tani Pal has given the answer and C has given absolutely correct answer. Tani Pal, you have given absolutely correct answer. Yes, pudendal nerve is supplying the perineal structures, and it is not a branch of lumbar plexus. Its root value is S2, S3 and S4, sacral. So it's not a branch of lumbar plexus. We know that lumbar plexus is formed from the ventral rami. As you can see here, it is formed from L1. Root value is L1, L2, L3 and L4. It takes a contribution from the 12th thoracic nerve subcostal, not the entire. So the important branches, I would like to show you the important branches. The important branches are iliohypogastric, ilioinguinal, genitofemoral nerve, lateral cutaneous femoral nerve, accessory obturator nerve. So all these nerves which I have shown here, this diagram is very useful, showing you all the branches of lumbar plexus: iliohypogastric, ilioinguinal, genitofemoral, lateral cutaneous femoral nerve, obturator nerve and accessory obturator nerve. Yes, so Tani Pal, you are absolutely right. Let's move on to the next, that is question number 2. Paralysis of third, fourth, 6th nerve with the involvement of ophthalmic division of 5th cranial nerve localizes the lesions to which of the following structure? Whether it is cavernous sinus, whether it is apex of the orbit, whether it is brain stem or base of the skull. Question number 2, mark the correct answer. Paralysis of third, fourth, 6th nerve with the involvement of ophthalmic division of 5th nerve localizes the lesion to which of the following region? A, B, C and D. You have got 4 options. Mark the correct answer. So 30 seconds I will give you. So the hint which is provided, or the key point you have to notice, is the nerve involved. So yes, I got an answer from Med Nair and waiting for others. Okay. So yes, mixed bundle of answers. So here the key point which is marked is 3rd, 4th and 6th and also the 5th. So my dear aspirants, if you see the anatomy of cavernous sinus, the correct answer is cavernous sinus. Actually cavernous sinus is having the relation of these nerves, okay, in the lateral wall, and it is these nerves are related. Also the nerve which is traversing is the 6th nerve. So I would like to show you this diagram. The correct answer is cavernous sinus, and very clearly you can get the answer. So let me just highlight this image. So my dear student, you can see here, so let me use yellow color. So you can see here I am using these okay, so 5 nerves are clearly here correlated with that of the cavernous sinus. So 4 nerves are lying in the lateral wall. So what you can see, oculomotor nerve, the trochlear nerve, the ophthalmic nerve and the maxillary division, and here the abducens nerve is passing through the cavernous sinus, and these nerves are lying in the lateral wall. So if you will see, these 5 nerves are exactly located with the cavernous sinus. So we will pick cavernous sinus as the right answer. So is it okay? We can clearly see in this image that trochlear, oculomotor, ophthalmic, abducens and maxillary nerves are related with the cavernous sinus wall. So these are the nerves which will be involved if there is injury to the cavernous sinus. Is it clear everyone? So Mednair, yeah, has already given the correct answer. So is it okay Tanipal? Cavernous sinus, okay. So in this image we can clearly see, yes, apex of the orbit you can get confused, but when we are talking about all the nerves, it is exactly lying at the correct location of the cavernous sinus. So let's move on to the next MCQ. That is MCQ number 3rd. All the best. Yeah, great. So see, all of the following are example of ball and socket joint except. All of the following are examples of ball and socket joint except talocalcaneonavicular, malleus incus joint in the middle ear, hip joint and incus and stapes joints in the middle ear. So according to you, which is not an example of ball and socket type of joint? Which of the following is not an example of ball and socket type of joint? 4 options are there. You have to mark the correct answer. All of the following are example of ball and socket joint except 4 options are there. Okay, so yes, I am getting Pal is telling it's B. What about others? So I got an answer from Pal. Yeah. Actually, yeah. So absolutely right, Mr. Pal, you are absolutely right. Malleus and incus is the correct answer. And can you tell me malleus and incus is which type? Yes, Tani Pal, absolutely right. Absolutely right. So can you tell me that malleus and incus articulation is which type of joint? Malleus and incus joint articulation in the middle ear is an example of which type of articulation? Yes, absolutely right, both of you, Tani Pal and also the Supratik Pal. So, okay, I just asked you that malleus and incus is which type of joint? What is the answer? Yes, it's a synovial joint. Which type of synovial joint? It's a saddle type of synovial joint. It's a saddle type of synovial joint. It's a saddle type of synovial joint. Now, all other options which is mentioned here as the all other option which is mentioned, talocalcaneonavicular ball and socket type of synovial joint. Hip joint we already know, yes, it's a ball and socket type of synovial joint, and incus and stapes is also ball and socket type of synovial joint. So I would like to show you a diagram which will make you clear. So no need to show you the diagram of hip joint which is already known to each and every student. So let's see the other one. So this is a schematic diagram where you can see the joints here. You can clearly see that we have got this is talocalcaneonavicular joint. Okay, so this bone which you are seeing is the talus bone. Here you are seeing the navicular bone, and lower down you can see the calcaneum bone. So if we talk about the anterior articulation, so actually talocalcaneonavicular joint is an anterior articulation. It's an anterior articulation which is occurring between the talus bone, between the calcaneum bone and the navicular bone, and this is an example of ball and socket type of articulation, which is quite clear in this diagram also. If we talk about the posterior part of this articulation, it is called as subtalar joint, where the subtalar joint is the joint where the inversion and where the eversion and inversion and eversion action occurs on. Okay, so this is the posterior aspect. So this is which joint? This is the subtalar joint. This is subtalar joint. That is plain type of synovial articulation. Now, if I talk about the other one which we marked as the correct answer, here you can see this is the malleus one, malleus ear ossicles, and this is the incus. Okay, the articulation between malleus and incus, if we talk about the articulation between malleus and incus, is called as inquidomalleolar joint, and it's an example of saddle type of synovial joint. Now, if I talk about inquidostapedial joint, that is the articulation between the stapes and the incus. This is an example of ball and socket type of synovial joint. So this is an example of ball and socket type of synovial joint. So I think the diagram is making your concepts more clear. So let me move on to the next MCQ, that is MCQ number 4. Question number 4. Epithelial lining of prostatic urethra. So which is the best answer? Epithelial lining of prostatic urethra. Epithelial lining of prostatic urethra. Epithelial lining of prostatic urethra. So options are, option 1 is stratified cuboidal epithelium, option 2 is stratified columnar epithelium, option 3 is transitional epithelium, and option 4 is stratified squamous epithelium. Question number 4, mark the correct answer. Lining epithelium of prostatic urethra is, which is the best possible answer? Epithelial lining of prostatic urethra. Stratified cuboidal, stratified columnar, transitional epithelium, stratified squamous epithelium. Question number 4, mark the correct answer. Okay, so yes, I am getting answer from Mednair. Okay, so yes. So yes, waiting for others. So if we are talking about the prostatic part of the urethra, it is having transitional epithelium, and third option, or you can see C option, is absolutely correct. Yes, transitional epithelium is absolutely correct answer. Mednair, you have given a absolutely correct answer. Transitional epithelium is the lining epithelium for pre-prostatic or prostatic urethra. So what I want that in many of the previous sessions, what I have seen in the MCQ sessions, that they have always asked the lining epithelium for different part of the urethra. So let's have a revision of that. So let's see. Okay, so when we are talking about the pre-prostatic and prostatic part of urethra, it is lined by transitional epithelium. When we are talking about the pre-prostatic or prostatic part of epithelium, it is lined by transitional epithelium, and when we are talking about membranous part, it is lined by pseudo-stratified columnar epithelium. Pseudo-stratified columnar epithelium. When I am talking about the bulbar part or the penile segment of the urethra, the lining epithelium of the bulbar and penile segment is done by pseudo-stratified columnar epithelium. So that means, that clearly means that the bulbar and penile segment, membranous part, is all having pseudo-stratified columnar epithelium. But when we are talking about the pre-prostatic part and that of the prostatic part, the lining epithelium is transitional epithelium. Okay, now coming to the next. When we are talking about the navicular fossa, it is lined by stratified squamous non-keratinized epithelium. Why non-keratinized? It is non-keratinized because it is not exactly onto the skin. But if we go more distally, okay, if we go more distally, yes, urinary bladder, yes, urinary bladder is also having transitional epithelium, you are absolutely correct. But if we are going more distally, its epithelium will change into stratified squamous keratinized epithelium at the region of glans penis, because it is very close to the skin. So exactly the lining epithelium will be similar to the skin. So is it clear to everyone? So done? Yes, let's move on to the next. Okay, so we have done with this. Let's move on to the next. Now let's move on to question number 5th. Which of the following can compress the esophagus? 5 options are there and you have to mark the correct answer. Which of the following can compress the esophagus? So the options are here. Mark the correct answer. Whether it is arch of aorta, whether it is right main bronchus, whether it is left vagus, the right brachiocephalic vein or brachiocephalic trunk. Question number 5th, mark the correct answer. Which of the following may compress the esophagus? We have got 5 options and you have to mark the correct answer. So your time starts now. Mednayer has given his answer. What about others? Okay, mixed bundle of answers are coming up. So yes, actually esophagus is having 4 constrictions. The correct answer is aortic arch. Okay, so I would like to show you the constriction arch of aorta. It's not the right main bronchus, it's the left main bronchus. It's the diaphragmatic opening, it's the esophageal opening in the diaphragm, and at the junction of pharynx and the esophagus we have got the another constriction. So altogether how many constriction? 4 constriction, and here A is the correct answer. So let me just highlight this diagram. So my dear aspirants, what you can see here, yes, absolutely right dear. So yes, what you can see, this is the junction of pharynx and the esophagus. So at the junction of pharynx, pharyngo, or you can say pharyngo-esophageal junction, there is the first constriction. So there is the location of first constriction, that is pharyngo-esophageal junction. When we are talking about the second one, that is arch of aorta crossing. As you can see here, this first and this the second arch of aorta is crossing. The third constriction, so this is the third one and this is the fourth one. So the third constriction will be left principal bronchus. And what about the fourth one? Okay, the fourth constriction is when the esophagus is traversing through the esophageal opening of the diaphragm. So esophageal opening of the diaphragm, my dear aspirants, is the fourth constriction. So is it okay everyone? So we have got the location of the 4 constrictions of esophagus. Let's move on to the next. Question number 6, all the best. Which fascicle layer is not correctly matched with the structure it encloses? Which fascicle layer is not correctly matched with the structure it encloses? We have got 5 options and you have to mark the correct answer. Which fascicle layer is not correctly matched with the structure it encloses? So we have got option A, superficial cervical fascia platysma. It's a match the following type of MCQ. The option B is investing layer of deep cervical fascia enclosing the trapezius and the sternocleidomastoid muscle. Option C, pretracheal layer of the deep cervical fascia including suprahyoid muscle. Option D, prevertebral fascia of the deep cervical fascia enclosing longus colli, longus capitis, scalenus and deep cervical muscle. And fifth option is the carotid sheath enclosing carotid arteries, internal jugular vein and the vagus nerve. So question number 6, mark the correct answer. Question number 6, mark the correct answer. Okay. So your time begins now. Question number 6, Mednayer has given his answer. What about others? What about others? So actually the correct answer is given by Mednayer and C is absolutely correct answer. Pretracheal layer of deep cervical fascia is enclosing suprahyoid muscle. So actually the word suprahyoid is wrong. Okay my dear aspirants, यहाँ पे क्या term use होता तो वो correct answer होता? Infrahyoid infrahyoid, it's not the suprahyoid, it's the infrahyoid muscle which the pretracheal layer of deep cervical fascia is enclosing. So यहाँ पे जो suprahyoid muscle mentioned है, that is the wrong one. So we have got C as the correct answer. Absolutely right, Mednair. Now if I talk about the other one, see here, superficial fascia is enclosing platysma is absolutely correct. We know that platysma is a muscle which is enclosed in superficial fascia. So it's an example of pannicular scarnosis. When we are talking about investing layer of deep cervical fascia, it is enclosing trapezius muscle and sternocleidomastoid is absolutely correct. Prevertebral layer is enclosing, it's forming a covering for longus colli and that of deep cervical scalenus group of muscle is absolutely correct. And carotid sheath, we already know it is containing the carotid arteries, internal jugular vein and vagus nerve. So only C option is wrong. Let me show you a diagram for it. Can everybody appreciate this? So what you can appreciate in this diagram? Okay, so you can appreciate the location of suprahyoid and infrahyoid muscle. See here. So these are the group of suprahyoid muscle. So I just want to highlight here this structure. What is this which I am showing with the blue color? This structure is the hyoid bone. This is the location of hyoid bone. So my dear aspirants, you can clearly see the location of hyoid bone, and the muscles which is located superior to hyoid bone is considered as suprahyoid muscle. So clearly we have got geniohyoid, digastric, mylohyoid, stylohyoid, all these muscles which is lying above the level of hyoid bone, these are the category of suprahyoid muscle. Okay, now let me show you the category of infrahyoid muscles. Now in this diagram, what you can appreciate, the muscles which is lying below it is the thyrohyoid, omohyoid, sternohyoid and sternothyroid. So all these muscles which is shown below the level of hyoid bone, these are the group of infrahyoid muscle. So my dear aspirant, now let's see the horizontal tracing of deep cervical fascia. So let me slightly highlight this diagram. Okay, now in this diagram, if you will see the horizontal tracing, you can clearly see that pretracheal layer is enclosing which muscle? The muscle enclosed is the omohyoid muscle, sternohyoid, sternothyroid. So my dear aspirants, we are not knowing that these are group of infrahyoid muscle, not a group of suprahyoid muscle. The location of sternohyoid, sternothyroid, omohyoid, thyrohyoid, all these kinds of the muscles is located below the level of hyoid bone. So this is an example of infrahyoid muscle, not the suprahyoid muscle. So option C was wrong, and that was the correct answer. Other than that, you can see, if I talk about the investing layer, okay, the outermost layer is the investing layer. You can see clearly it is enclosing two important muscles. Here you can see trapezius muscle is the one, and the other one is sternocleidomastoid muscle. So the other muscle is sternocleidomastoid muscle. So that option was absolutely correct. And when I am talking about the prevertebral layer, you can see it is enclosing it is lying anterior and enclosing the scalenus group of muscle. Actually it is covering the scalenus medius anterior muscle, levator scapularis splenius capitis muscle. So absolutely right. And what about carotid sheath? See here, this is the carotid sheath which is enclosing the structures which is shown here. This is the carotid sheath, and clearly you can see it is enclosing carotid arteries, vagus nerve and the nerve that is recurrent laryngeal nerve. So we have done with this. Now let's move on to the next, that is MCQ number 7. Cremaster muscle is innervated by which of the following? Question number 7, mark the correct answer. All the best. Easy one. It's a direct MCQ. Cremaster muscle is innervated by which of the following nerve? Whether it is genital branch of genitofemoral nerve, whether it is ilioinguinal nerve, whether it is T12 femoral or obturator nerve. My dear aspirants, what is the correct answer? Cremaster muscle is innervated by yes, absolutely right. So genital branch of genitofemoral nerve, Sai, Creation, Pal and Mednair, all of you are absolutely right. It is getting innervation. Cremaster muscle is getting innervation, which is having an origin from internal oblique muscle. It is getting innervation. So yes, Tani, Pal, absolutely right. The correct answer is genitofemoral nerve, genital branch. Now let me show you this diagram. The muscle which is shown here and which is shown here with the brown color, these muscles are the cremaster muscle related to the scrotum, and you can see here that this is muscle which is which is formed by the internal oblique muscle fibers. So I would like to give you the brief about the cremaster muscle. Now see here, if I talk about the cremaster muscle details, the cremaster muscle is originating from, as I told you, it is originating from the internal oblique. This is also asked as an MCQ. What about the insertion? It gets inserted into the tunica vaginalis layer of spermatic cord, and its arterial supply is cremaster artery. The nerve innervation is genital branch of genitofemoral nerve, and the action is it is raising and lowering the scrotum. What is the action of cremaster muscle? It raises and lowers the scrotum. Cremasteric reflex is also done by stroking the layer, stroking the medial aspect of the thigh region, and we can see the cremasteric reflex. Yes dear, spermatic cord content, yes Mednar, is also very important. You have to know all these arteries. Actually we have got cremaster arteries, we have got artery to ductus deferens, all these arteries, testicular arteries. So actually these arteries and many of the structures of the veins, pampiniform plexus of the veins, all these structures are included in the spermatic cord. So there is lymphatics, there is nerve innervations, there is arterials, the arteries are going. So I have shown you the cut section of testis where all these structures are cut section of the testis we have discussed, and also we have discussed the cut section of the spermatic cord where all these structures are traversing. Actually arterial supply is very important because the arteries, 3 arteries which is traversing through the spermatic cord is getting origin from 3 different sources. So that is also important point about the MCQ. Yes, absolutely right, Mednar. Now let's move on to the 8th number MCQ. Superior suprarenal arteries are branch of. Superior suprarenal artery is the branch of abdominal aorta, renal artery, inferior phrenic, celiac trunk, and superior mesenteric artery. So your time starts now. Question number 9, mark the correct answer. Superior suprarenal arteries are branch of. 5 options are there. Okay, I am talking about superior. How many suprarenal arteries are there? 3. There is superior, there is middle, and there is inferior. So we are talking about the superior one. Superior suprarenal artery is a branch of abdominal aorta, renal, inferior phrenic, celiac trunk, or superior mesenteric. Your time starts now. So yes, I am getting many answers, A, B. So mixed bundle of answers are coming up. Which one is the correct one? So actually we have got 3. Superior, middle, and the inferior. So actually the correct answer is C, and let me write the answer. So okay, when we are talking about the superior suprarenal artery, its origin is from inferior phrenic artery. It is originating from inferior phrenic artery. If I am talking about the middle suprarenal artery, its origin is from directly from the abdominal aorta, and if I am talking about the inferior suprarenal artery, its origin is from the renal artery. So okay, please do revise. This is also very important. You have to know the source of the origin of the 3 suprarenal arteries, 3 different sources. Now my dear aspirants, it will be more clear if I show you this diagram. Okay, see here, this is inferior phrenic artery and superior suprarenal artery is arising from inferior phrenic artery. Now see here, this is the middle suprarenal artery and it is directly arising from abdominal aorta. Now if I talk about the inferior suprarenal artery, it is arising from renal arteries. So is it clear to everyone? 3 suprarenal arteries having 3 sources of origin. 3 suprarenal arteries having 3 sources of origin. Let's move on to the next MCQ, that is MCQ number 9th. All the best for the 9th MCQ. Which statement correctly relates to the third part of duodenum? Which of the following statements, so here we have got 5 statements and you have to tell me which of the following statement is absolutely correct for the relations of third part of the duodenum. Okay, so let's move. Option A, it is supported by the suspensory ligament of duodenum. Option B, bile and pancreatic ducts enters into the posteromedial wall. Option C, it is crossed by superior mesenteric artery and vein. Option D, it attaches to hepatoduodenal ligament. And option E, it lies right and runs parallel to that of inferior vena cava. Yes, so we have got 5 options and you have to mark the correct answer. Question number 9. So, waiting for everyone to answer. Let's mark the correct answer. So, just 30 seconds. I will give you 30 seconds. So, okay, I got the answer from Mednair. Mednair has already given the answer. So, okay, be quick in answering and don't worry about right and wrong. Just mention the answer. Don't worry. VV associate. Yes, cadaveric image based session. So, okay, Saturdays and Sunday, I am on Saturday, okay, okay, let me know everyone. So, actually on Saturday, 3 sessions are of clinical anatomy MCQ sessions I have targeted. On Sunday also clinical anatomy MCQ sessions are there. So, do you want me to take an entire session? So, I was just wanting your suggestions also. So, maybe in the coming, I am just thinking of in the coming week I will take a cadaveric image session. So what you want me to take the session, whether on the special platform of Unacademy or YouTube session? Let me know. Joseph, you want me to take the session on the special platform or on the YouTube session? So we will have a 50 images, cadaveric images altogether. So maybe if I take the session on the YouTube, so it will be of 2 hours or 3 hours continuous session where I will discuss 50 image based MCQs, most cadaveric image based MCQs. So Mednar, Ajit Sarma, Sai, everyone is present there. So in the coming week on the Friday, I will take a YouTube session. 50 cadaveric image sessions will be discussed and the link will be provided to you in Let's Crack NEET PG platform. Joseph, it is okay. So we will proceed like that. Maybe the session I will take in the continuation, because what happens, like I am taking a session and giving you a break in between, so at times you are not able to correlate. So maybe a continuous session I will plan. Yes, okay. Okay, which statement correctly relate to third part of the duodenum? So 5 options are there, mark the correct answer. Question number 9. Welcome Joseph. Question number 9. So Mednair has already given the answer, and what about others? So yes, absolutely correct answer is given by Mednair. It is crossed by superior mesenteric vessels. Absolutely right. Yes, it is crossed by superior mesenteric vessel, that is the third part of duodenum. So I would like to show you a diagram for each of this component which will clearly help you to understand. Actually, this inferior vena cava is not running parallel but it is running posterior. So it is the wrong option. Suspensory ligament of duodenum is located at the junction of duodenojejunum junction, not to the third part. Bile and pancreatic duct is opening into the second part of duodenum, not in the second part of duodenum interior, not in the third part. And hepatoduodenal ligament is attached to the initial, you can say first part of duodenum, not to the third part. And inferior vena cava is lying posterior to duodenum, third part, not running right or parallel. So we have got the correct option. So we have got C as the correct answer. So let me show you. So here you can see this is showing the relations of the third part of duodenum. The structures lying anterior to the third part of duodenum is following. The structures are superior mesenteric vessel, root of mesentery and coils of jejunum. So if you want, I will slightly enlarge this image. See here. The structures related are superior mesenteric vessel, root of mesentery and coils of jejunum. When I am talking about the posterior relation of the structures lying posteriorly are right psoas major, right ureter, right gonadal vessel, inferior vena cava, abdominal aorta and inferior mesenteric artery. Many structures are related. So we can clearly see inferior vena cava is lying posterior to the relations of third part, but the superior mesenteric artery, which we have marked as the correct answer, is lying anterior. So it is crossed by superior mesenteric vessel. So clearly you can see it is crossed by superior mesenteric vessel anteriorly. So yes, C is absolutely correct answer. Let's move on to next. Before that, one of the option was suspensory ligament, and you can see here it is attached to the duodenum jejunum flexor or junction. Now the one of the option was opening of the common bile duct and all. You can see here its opening is into the second part of duodenum. Its opening is into the second part of duodenum, not the third part, along with the interior, that is major duodenal papillae. Now if I show you the duodenal ligament, hepatoduodenal ligament. So what you can see exactly, the this part is the hepatoduodenal ligament, and exactly this hepatoduodenal ligament is attached to. So if you will see, this hepatoduodenal ligament is attached to the first part or initial segment of the duodenum. First part or initial segment of duodenum, not the third part. So let me again start with the question number 10th. Lateral displacement of patella is prevented by which of the following muscle, whether it is rectus femoris, vastus intermedius, vastus lateralis or vastus medialis. Question number 10th. Lateral displacement of patella is prevented by rectus femoris, vastus intermedius, vastus lateralis and vastus medialis. So yes, I got an answer from Ajit Sarma, waiting for others. Actually D option is perfectly correct. This vastus medialis muscle attachment on the patella is onto the more aspect or greater area, and it's on the medial and onto the base of patella is getting the attachment of vastus medialis. So it is preventing the lateral displacement of the patella. This will be very clear if you will see this diagram. What you can see, this is the vastus medialis muscle, and you can see the area where it is attaching to the patella is more onto the medial aspect if you compare it with the vastus lateralis. Vastus intermedius is exactly at the basal part. The medial extension is more of vastus medialis as compared to the vastus lateralis. So this is the correct answer. We can see both rectus femoris and that of vastus intermedius is exactly attached onto the base, but we can see the medialis is extending more onto the medial 2/3 part of the medial aspect of patella, and lateralis onto the lateral 1/3 part. Question number 11. Which is correctly paired with its nerve supply? Options are, 5 options are there. Flexor pollicis longus, getting innervation from anterior introosseous nerve. Flexor digitorum profundus from anterior introosseous nerve. Extensor carpi radialis longus from posterior introosseous nerve. Brachioradialis from posterior introosseous nerve. Abductor pollicis longus from anterior introosseous nerve. So these are the options, and you have to mark the correct answer. Question number 11. Which is correctly paired with its nerve? Okay, question number 11, mark the correct answer. Which of the following is the correct pairing? The correct answer is A. Flexor pollicis longus is having the innervation by anterior introosseous nerve. Let me show you the answers. So actually this is the correct option. Yes, flexor pollicis longus is the muscle which is lying on the deeper aspect of the anterior aspect of the forearm, and the innervation is from anterior introosseous nerve. Flexor digitorum profundus is not innervated by anterior interosseous nerve. Actually, it's not only this that it is getting innervation from anterior interosseous nerve, it is getting innervation from the branch of both median plus ulnar nerve. So, this is not the correct option. Extensor carpi radialis longus, not from the deep branch, it is getting directly innervation from radial nerve. And if we talk about brachioradialis, it is also getting directly innervation from radial nerve, not the pin nerve. If we talk about abductor pollicis longus, it is a nerve of extensor compartment, it is a muscle of extensor compartment. So, abductor pollicis longus again is getting innervation from pin nerve, posterior interosseous nerve, not from anterior interosseous nerve. Actually, extensor compartment muscle all is getting innervation from pin nerve, posterior interosseous nerve, except extensor carpi radialis longus and brachioradialis, which is getting innervation from radial nerve. So, we got A as the correct answer. Question number 12. Ischial bursa separates inferior part of which muscle from the ischial tuberosity? Ischial bursa separates inferior aspect of which muscle from ischial tuberosity? Gluteus maximus, gluteus minimus, gluteus medius, piriformis or obturator internus muscle? 5 options are there, mark the correct answer. Ischial bursa separates inferior part of which muscle from ischial tuberosity? Your time starts now. Gluteus maximus is the correct answer. Actually, gluteus maximus is the correct answer. Ischial bursa is forming the separation between the muscle and ischial tuberosity is the gluteus maximus muscle. Let me show you this diagram where important bursas relation has been shown. So, we have got important bursas which is mentioned here is trochanteric bursa, which is between the greater trochanter of the femur and gluteus maximus. Glutofemoral bursa is between iliotibial band and vastus lateralis. Glutofemoral bursa is between iliotibial band and that of vastus lateralis, and this was asked in the MCQ, that is ischial bursa. It is exactly located between gluteus maximus and ischial tuberosity. Trochanteric bursa is from trochanter, greater trochanter and that of gluteus maximus. Yes, so I think this image is clearly showing you the important bursa's location and in between which bony landmark and the muscle. Let's move on to the next, that is question number 13. All the best. Dangerous space lies between. The dangerous space of the neck is located between which two layers? Whether it is prevertebral layer and the alar fascia, whether it is buccopharyngeal layer and the prevertebral fascia, whether it is pharyngobasilar and the prevertebral fascia, whether it is buccopharyngeal or pharyngobasilar fascia. So, we have got following. No, Ajit, don't worry about that. Please don't get confused. Please don't. Please don't worry about this. Many my free sessions are there. You can be present for my sessions and with the practice of MCQs. So, it is not the matter whether you are solving more of MCQs are correct. What matters is revision. Anatomy is a very vast subject and it requires more of revision because many of the things are factual. Okay. So, बहुत सारे parts anatomy जो facts है, but if you correlate and you go conceptually, then it will remain in your mind for longer duration of time. So, what is required is revision and practice. So, that is the key to success for everyone. No one has just targeted their exam or they have scored much more with 1 or 2 revision. It requires 10 time revision. So, I am there and I will always be there. So, don't worry and have faith in yourself. Don't blame yourself. Okay. So, see the positive point that you want to improve yourself, that is the positive thing and that is the key to success. Okay, Ajit? Okay. So, yes, I got an answer from Mednair. It's 13B. Okay, everyone has given their answer. Let me give you the correct answer. Dangerous space. Actually, it's very important that you have a differentiation. Retropharyngeal space. Yes, my dear. Actually, that is the problem. Actually, we have to, danger space is not the retropharyngeal space. Let me write down. There is difference between retropharyngeal space and that of danger space of the neck. Danger space of the neck. So, okay, in many books they have directly mentioned buccopharyngeal fascia and prevertebral layers, but that is wrong. Actually, buccopharyngeal membrane and prevertebral fascia के बीच में आपका कौन सा space होता है? Retropharyngeal space, that is called as Glittie's space also. That is also called as Glittie's space. Correct answer is A. Prevertebral fascia and alar fascia is the exact location of danger space of the neck. I would like to show you a diagram with sagittal section of head and neck which will clear your concept. So, let's move on to that diagram. Okay. So, everyone, can you appreciate? I have shown you here दो spaces है, एक red color में marked है, वो danger space है, और दूसरा वाला space yellow color में marked है, that is true retropharyngeal space. What is the term which is used? True retropharyngeal space. So, it is very important that you should have a differentiation between the true retropharyngeal space and that of the danger space. So, see here, this is the danger space and this is the true retropharyngeal space. Now, you can see exactly, if I talk about retropharyngeal space, it is lying exactly anterior to danger space. So, it is exactly located between the posterior pharyngeal wall. So, anteriorly कौन सा layer होगा? Posterior pharyngeal wall. What will be the layer which is lying posteriorly? Posteriorly, the layer which will be lying here is the alar portion of deep cervical fascia. Actually, it's which layer? It's the alar portion of deep cervical fascia. Now, concentrate on the space which is lying posterior to alar fascia. So, let me use another. So, you can see the space lying posterior to alar fascia which is shown in the red color. So, posteriorly it is having a covering of prevertebral layer of deep cervical fascia. So, is the concept clear to everyone? What is the difference between the true retropharyngeal space and the danger space of the neck? Means true retropharyngeal space is the space which is lying anterior to danger space of the neck, and true retropharyngeal space is lying between the alar portion of deep cervical fascia and the posterior pharyngeal wall, that is buccopharyngeal fascia, and the true danger space is lying between alar portion and that of the prevertebral layer of deep cervical fascia. Is it clear to everyone? Ajit, Mednayer, Joseph? So, let us move on to the next, that is question number. So, yes, give me a thumbs up if it is clear. Now, let us move on to question number 14. All statement considering, okay Ajit, all statement considering femoral sheath is correct except, all of the following statement considering femoral sheath is correct except option A, it extends 3 to 4 centimeters inferior to inguinal ligament. It is formed by inferior prolongation of transverse salus and iliopsoas fascia. Okay. Thank you, Mednayer. It encloses the femoral nerve. It ends by becoming continuous with the adventitia layer of femoral vessels. So, yes, question number 14 is all of the statement is correct except, you have to choose except, that means you have to choose the incorrect statement. So, okay, you have to choose the incorrect statement about femoral sheath, which is not correct statement about femoral sheath. Okay. Okay, not the correct one, incorrect one. Okay. So, now you can change your answer. Okay, so always we have to keep patience while reading the MCQs. So, sometimes we are knowing the answers, but we are not concentrating on the word except. So, yes, C is absolutely correct answer. We know that femoral sheath, is only covering the femoral vessels. Okay, it is forming a covering for the femoral vessels, and we clearly know that femoral nerve is lying outside the femoral sheath. It's a simple one only. Okay, the medialmost part of it can contain the inguinal lymph node, deep inguinal lymph node of Cloquet. So, let me show you this diagram. This is, let me just highlight this diagram. So, here you can clearly see that this is the femoral sheath. Okay, so you can clearly see this is the femoral sheath and this is forming a covering for that of femoral vessel. See here. So, medial most part is the femoral canal which is containing the deep inguinal lymph node. deep inguinal lymph node, that is called as lymph node of Cloquet. Other than that, it is containing femoral artery here and it is containing femoral vein. If you will see here, this is the femoral nerve, and this femoral nerve, if you will see, this femoral nerve is exactly lying outside the sheath. It is lying outside the femoral sheath. Done? So, femoral sheath is not covering the femoral nerve, which has been shown in this diagram. So, thereafter let us move on to the next, that is question number 15. Which of the following muscle is the muscle of first arch? Which of the following muscle is the muscle of first arch? Mark the correct answer. Which of the following muscle is the muscle of first arch? Whether it is stylopharyngeus, whether it is tensor tympani, whether it is platysma or cricothyroid. Question number 15. Okay. Absolutely correct. Tensor tympani is absolutely correct. Yes, absolutely correct. So, stylopharyngeus, the muscle of the third arch, tensor tympani, the muscle of the first arch, platysma, muscle in the superficial facial expressions and all. So, that will be of the second arch. Cricothyroid is the muscle of larynx, the fourth. So, this is related with the nucleus ambiguous. Okay. So, yes, stylopharyngeus, yes, absolutely right. Tensor tympani is the muscle of first arch. It is absolutely correct. Now, my dear student, it is also important that you should know all the muscles. So, muscles of first arch, you can complete the list. Muscle of first arch. So, the question was about the first arch. So, can you help me in writing the muscles of first arch? Which all muscles? Yes, muscles of first arch is muscles of facial expression. Muscles of first arch is muscles of mastication. Sorry, muscles of mastication. We are talking about first arch. Is the muscles of mastication, what are it? Lateral pterygoid. Yes, lateral pterygoid, medial pterygoid. Masseter muscle, temporalis muscle. So, do you want to just give me the other list of muscles also? So, yes, these are the muscles of mastication. Other than that, which all muscle? Anyone wants to complete the list? Which all other muscle? Tensor tympani muscle, tensor villi palatini, tensor villi palatini muscle. Yes, mylohyoid muscle, absolutely right, mylohyoid. Anything more? Anterior belly of digastric. Anterior, posterior belly of digastric is from second arch. So, anterior belly of digastric. Yes, anterior belly of digastric and anterior belly of digastric muscle. Posterior belly is from the second arch. Anterior belly of digastric is from the first arch. So, this is the list of the muscle arising from the first arch. These are all list of the muscle arising from the first arch. Got it, everyone? Yes. So, my dear aspirants, okay, before ending the session, what I want you to know is the free sessions on the Unacademy platform. So, free sessions of the Unacademy platform. Okay, yes, nerve, mandibular nerve, absolutely right. So, actually when we are talking about free session, what I want you to know that today is Saturday. So, all of you do note down, Saturday I am taking 6 p.m., 7 p.m. and 8 p.m. So, actually these all sessions are just of 40 to 45 minutes, okay. It is just of 40 to 45 minutes, and on Sunday again I am taking two morning session, 10 a.m. session, 11 a.m. session. 10 a.m. and 11, because Sunday is a holiday. If you wake up at 9 p.m. or 9 a.m. also you can attend my session. So, it is not too early, it's just 10 and 11. So, all the session is just of 40 to 50 minutes. And we are going to discuss clinical anatomy MCQs. Clinical anatomy MCQs. So, what I want that every one of you should be present live for the session. And what is the plus point? What is the plus point of attending the sessions on Let's Crack NEET PG platform live? That means that you can interact with me, you can write your messages, you can interact, you can ask your doubts right itself. You will get the PDF notes also after completion of the session. So do join on the Saturday evening and on the Sunday morning for my 5 sessions of 40 to 45 minutes each. Clinical anatomy MCQs, I will cover up more than 50 clinical anatomy MCQs. That means a large chunk of clinical questions will be covered by you. And those students who have not attended live sessions, they have to download the Unacademy app. They have to find their goal as NEET PG, and then they have to use my code. So you can use my code ANAT10 to unlock the free sessions on the Unacademy platform, and just use this code. All the links of the sessions will be provided in the Let's Crack NEET PG platform and also in the other groups of the Unacademy. So do join live for today evening and Sunday morning clinical anatomy MCQ series. Now, before ending the session, what I want you to tell thank you. So I want you to tell thank you and do subscribe and like the Let's Crack NEET PG platform, share, and do join me for the live sessions on the Unacademy by using the code ANAT10. You can, if you want to take the subscription, you will get 10% discount. So you can use my code not only as an unlock code, but also for taking the subscription, you can get 10% discount. So do join me for Saturday evening and Sunday morning session. All the best. Keep studying. Thank you so much. So yes, thank you so much. We will again meet up with the upcoming sessions. All the best, students. Thank you. Thank you, everyone.